Thank you for inviting me to speak today. I'm Helen Peters and I manage the Integrated Screening Outcomes Surveillance Service, known as ISOS. And I'll be talking about pregnancy characteristics and outcomes of women with vertically acquired HIV in the UK. So the number of women of reproductive age with vertically acquired HIV has been increasing globally, but there are knowledge gaps in this population. In the UK, there are under 1,000 pregnancies a year to women living with HIV, and the vertical transmission rate is under 0.3%. I'll present population-level pregnancy outcome data for this important emerging cohort of pregnant women with vertically acquired HIV. ISOS conducts surveillance on behalf of the NHS Infectious Diseases in Pregnancy Screening Programme. All pregnancies to women living with HIV, their children and any children diagnosed with HIV are reported to ISOS. The Children's HIV and AIDS reporting system runs alongside ISOS and collects long-term follow-up of all children living with HIV. Data have been collected for over 30 years, and concurrent paediatric and maternity reporting streams offer a unique opportunity to link historical paediatric reports of women diagnosed as children and seen for paediatric care in the UK to their pregnancy reports. So we define women with vertically acquired HIV as women diagnosed under 14 years of age with no other risk factors apparent. The first pregnancies to women with vertically acquired HIV were in 2006. So our population for analysis is pregnancies with known outcomes reported from the start of 2006 to the end of 2021. And the objectives here are to describe maternal and pregnancy characteristics among women with vertically acquired HIV and trends over time, to assess birth and infant outcomes in this group, and to compare characteristics and outcomes to women with heterosexually acquired HIV. So there were over 17,000 pregnancies reported from 2006 to 2021, and 96% of these were to women who acquired HIV heterosexually. There were 202 pregnancies to 131 women with vertically acquired HIV. And you can see from the table that the proportion has increased tenfold over the period. So looking at maternal socio-demographics among the 202 pregnancies, there were a higher proportion of pregnancies to women with vertically acquired HIV to UK-born women, so that was 40% compared to 15% for women with heterosexually acquired HIV. And women with vertically acquired HIV had a younger median age at delivery of 24 years compared to 33 years. For women with heterosexually acquired HIV. Looking at women's paediatric diagnosis, so the median age at diagnosis was 6 years of age, with 22 women diagnosed under 1 year of age. 62% of the women were diagnosed in the UK, and 86% of women were reported to ISOS in childhood as part of our paediatric surveillance. You can see here a breakdown of how the women were diagnosed. Overall, 18% of women, had a history of an AIDS-defining illness, and 12 of these women had an AIDS-defining illness at diagnosis. To give you an idea of the number of pregnancies, among the 131 women with vertically acquired HIV, 81 women had 1 pregnancy reported, 34 had 2 pregnancies, and 16 women had more than 3 or more pregnancies reported. In terms of pregnancy outcomes, 170 pregnancies resulted in a live birth, and there was a higher proportion of terminations amongst women with vertically acquired HIV, so that was 9% compared to 2% for women with heterosexually acquired HIV. There was also a higher rate of stillbirths, so 2% compared to 0.8% for women with heterosexually acquired HIV, but the proportion of women with a miscarriage was lower at 5% compared to 8% for women with heterosexually acquired HIV. So here you can see some of the key pregnancy characteristics in blue compared to women with heterosexually acquired HIV in orange. So you can see that women with vertically acquired HIV tended to book earlier, and a higher proportion were on ART at conception. However, a lower proportion had a CD4 count over 500 and a lower proportion delivered with undetectable viral load. And all of these differences were statistically significant. And then when we restrict pregnancies that were conceived on ART, the difference in proportion delivering with undetectable viral load was greater and also significant. In terms of trends over time, there were significant increases in the proportion of pregnancies booked at under 13 weeks, on ART at conception, and delivering with undetectable viral load for both women with vertically and heterosexually acquired HIV. And looking at pregnancy outcomes, you can see there are significant differences in preterm delivery rates and birth weight between women with vertically and heterosexually acquired HIV. The congenital anomaly rate is 5.7%, but there was no significant difference compared to women with heterosexually acquired HIV. And there was just one transmission amongst the 150 infants with confirmed infection status to women with vertically acquired HIV. So to summarise, among this growing population of women, we are seeing HIV-related markers improving over time and only one transmission to date. Successes reflect the strong clinical pathways in the UK. And although most women were on ART at conception, women with vertically acquired HIV are more likely to have detectable delivery viral load. We need to do further work in order to explore the reasons behind this, as well as looking at the higher preterm delivery rates seen. ISOS and CHARS surveillance enables continued monitoring of these emerging trends and provide opportunities to explore related areas such as sequential pregnancies and longer-term outcomes in children born to women living with HIV. So a big thank you to all the respondents to ISOS and CHARS, as well as the rest of the ISOS CHARS team. Do get in touch with me if you have any questions. My email address is listed there. And if you want any more information on ISOS, you can look on our website and also view our annual HIV report. Thank you very much for listening.